335 days since our first case back on March 12th. We are 47 weeks into it, and this Friday will be unbelievably 11 months since we've been in this new environment of COVID-19. But unfortunately, sadly, we lost a county resident last night, a woman in her 70s, and my condolences and prayers go to the family and to all the families, to the 336 people that passed away from this since this started a little months ago. So it's a difficult time for anyone to lose anyone, but it's harder now because of the new environment that we're in. So please take the time and think of them. And now, as of today, we have 19,275 cases of COVID-19 in Albany County to date. We have an increase of 87, which is, it's hard to believe when Dr. Will and I would sit here and think 2, 3, 6 was bad, and 8, you get numb. We do. Everyone gets numb. So it's like 87 compared to where we were. It's like a great number. We're coming down. So 87 positive cases since yesterday, and you can see on the graph on the screen, the curve is starting to go down again, which is good news. Our 5-day average is 95.8. Yesterday it was 102.6, so which is also good news that people are doing the right thing, and that's what we like. There are currently 1,822 people under mandatory quarantine. There's since yesterday, and that number was 1,765. Of our new positive cases, there was 32 that had close contact to a positive case, 7 are healthcare workers, 2 reported traveled out of state, and 46 at this point don't have a clear source of infection. As of today, we have 58,930 people that have completed quarantine, which we've been saying every day when we have these. So 58,930 people completed quarantine. Of those, 18,407 tested positive for the virus and had recovered. That's an increase of 159 recoveries since yesterday. There are 8 new hospitalizations overnight. There's 97 people currently in the hospital from the virus. Yesterday, the number was 99. There are 12 patients currently in the ICU. Yesterday, there was 17 people in the ICU. We still need everyone to continue. Please wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and we'll get through this. And thank you to everyone who's doing the right thing out there. If you haven't got tested for COVID, please, those who want, please go to our website and check that out. But also, for those who want to get the vaccine, go to this number, 1-833-697-4829. You can call it. It's the New York State hotline, and they will explain to you what category you're in and walk you through it. So call that number, 1-833-697-4829. Also, United Way, thanks to Pete Gannon and them, 211 for a hotline for getting information, to walk you through the website, to tell you what you need to do, where you fall. So pretty simple, 211. It takes a lot of partnerships to get through any scenario that you're in, and unfortunately, I think people get a little glimpse of our health department and the mayor's office and the county executive's office, and we do these type of partnerships all the time, pre-COVID, during COVID, and a variety of other issues that we constantly got to work together with. And it takes us to put our differences aside, roll up our sleeves to get through things and to work for the people that put us in office, for Dr. Whalen to protect the health and safety of the residents of the county, and base it on science, not base it on votes, like I said before, and everything else. But I do want to thank Mayor Sheen for the partnership we did with Mohawk. When we announced it a month ago, basically that announcement was in the works for 2 months prior to even announcing Mohawk. In Mohawk, and thank them for their being part of the fabric of the community in the Capital Region. Mohawk Ambulance, who invested a lot of money to make this happen with refrigerations and training and bringing people on board. They did a lot of logistics to get it where we could get shots to people that have not gone out. The mayor and I have identified a lot of people that are, been doing the right thing. They haven't gone out. And people that just don't want to sign up on websites and everything else, for a variety of reasons. So we put a lot of work into it, and it was a pilot program. And I do want to thank Governor Cuomo for believing in this pilot program, for signing off on it and getting the vaccines last week. But the pilot program that we announced in January has been a great success. Of 90% of those vaccines where it was 65 and plus. So again, I do want to thank the governor, and I can't thank him enough for signing off on this program and letting us get shots in arms. But remember, Albany County is not allowed to vaccinate these groups in our county pod. So this is a huge step forward because we can't do 65. And I can assure you, Dr. Whalen knows a lot of people I do that are over 65 that want to get vaccinated, but we can't do it through our pod. So this is a great step to handle this population of people that need it, and that we identify that have underlying health issues that have been affected the most through this, the most amount of people that have passed away that couldn't even qualify to get the shot. So thank God that changes this February 15th, and people with underlying health conditions can get the vaccine and continue to tackle the 1B and 1A. But also, there's lessons learned in everything. And I'm going to let the mayor talk about the statistics and all that, but lessons learned. It's not perfect. Listen, I'm going to stumble, I'm going to fall, I'm going to pick myself up, dust myself off, readjust, and figure out what went right and what went good. I've said this since the beginning. I've said this for 11 months. I haven't pointed the finger at the president then, the new president, the governor. We have to get through this in a partnership. And there's not times. It's easy to go online. It's easy to complain. Be part of the solution, not part of the problem. And we need people to come to the table and have a great conversation. We can agree to disagree, but we need to have a dialogue and solutions to the problems, not sit there and point the finger out why something didn't happen, or how come this person didn't get taken care of. I get it. I know people are frustrated. I know elected officials are frustrated. But again, like I said, it's a marathon, not a sprint. We can't get upset. People need our elected officials to be cool, calm, and collective, and to be leaders at this point in time. And I've always said this: lead, follow, get out of the way, because we need leadership. And that's why I partner with Mayor Sheen and with Mohawk and our health department. We need leadership and partnerships, because it's not one person getting us through this. It's everyone collectively getting us through this. And, I'm going to let her talk about the success. And then we were so lucky enough to have an extra pod on Saturday because there was some vaccine, not as much as we hoped for. But, and again, learning that other people are out there doing vaccines that we're not aware of. And that's one thing I talked to General Murphy about the other night, or last night. I might call him last night. I think it was last night. That, we need to better communicate. But again, these are all good lessons. And I'll say to the mayor, thank you for her leadership when we found out Albany Pharmacy College had vaccine and they were going out in the community. So again, talking, communicating, working together. It's simple. I always say in the office, CCR, communicate, coverage, results. Very easy, but you got to communicate, you got to have coverage, and you got to have results at the end of the day. And the fact that the mayor brought all that in was awesome. And now we're working in a partnership to move out. We've also been working through our Department of Aging with Rite Aid. And they needed help. We stepped up with our aging department, so we're helping them get the vaccine out. And they're going to use that model program across the country because it's been so successful. I didn't even have an opportunity to talk about that, because there's so much things going on. And I'll say this: we try to put out every information that we can. We try to be 100% transparent, and we try to constantly just update. But there's so many moving mechanisms every given day, and things change. Like in the media, whatever was said yesterday changed 2 hours later. Whatever was said this morning changed, and but we're going to win this because we're united here in Albany County, and I couldn't ask for a better partnership than with Mayor Sheen. And I do want to say, I'm glad. I know some legislators had some issues, and I'm glad that Legislator Wanda Willingham, Sheriff Apple, and the partnership got the vaccines to the people yesterday for her, 20 of them, I think 30. Great. That's what it's about, partnerships, working together to move forward. But Mayor Sheen.
Great, thank you so much. And I want to thank the county and the governor for believing that we could find a different way to get the vaccine to people who need it. We have heard stories across not just New York State, but across the country of vaccine being sent into lower income communities, and then people from outside of those communities flooding in, filling those appointments, and getting the vaccinations in communities where the intention was to get it into the arms of the people living there. And so we stepped back and said, there has to be a better way. We reached out to the Alliance for Better Health, and they said, absolutely, there's a better way. We can pre-register people. We can basically create lists that allow you to then target the very people that you are trying to reach by scheduling those appointments with those individuals. And so we've learned a lot through this process. The Alliance for Better Health set up a platform. We had 3 days, less than 3 days actually, when we got notification of that we were getting the vaccine to fill those appointments. And so I'm here to speak about the results in the city of Albany, because that's the part that we were actively involved in, and we had great partnerships with our other elected officials, with volunteers who helped to ensure that we were filling those appointments with the very people that we were expected to target, which were residents of Westview Homes and residents of Townsend Homes, which are 2 Albany Housing Authority complexes in the city of Albany, with appointments then also offered to other people living in housing and living in the surrounding area. And so we were able in the city of Albany to vaccinate 401 people. Just to lay out the demographics for the city of Albany, the city is about 6% Asian, 24% Black or African American, 11% Latino, and 57% white. Overall, in the 3 clinics that we had, because we did have, as the county executive said, an additional clinic on South Pearl Street on Saturday, because we did have additional vaccine. Overall, we vaccinated 62%. Of the people that we vaccinated were Black or African American, so we overperformed on that. 29% were white, and where we found that we underperformed was in the Latino Hispanic community. Overall, it was 5%. At Central, where the Westview Homes, we did hit the target of 11.5%. But what we've learned from this process is that when you have volunteers who reach out and who help to ensure that a person has an appointment and has a plan to get there, they will come. And we saw a huge change between what happened at our first vaccination site, where we had about 40 to 45% of the people who were supposed to come did not come. We found out some of them had gotten vaccinations the day before, so again, we're learning. That what happened on our Saturday clinic was that when we had that soft touch, when it wasn't just a robocall or an email confirming the appointment, when you had a human being confirming that appointment, we had a much higher turnout rate. And you know, to me, the only downside, and it's a big downside because we disappointed people, is that we didn't have enough vaccine. And so I think that even that is a good news story from the standpoint of being able to advocate to the state that if you send us vaccine, and you can send it to Mohawk, you can send it to a pharmacy, you can send wherever that vaccine goes, if you allow us to use this system to ensure that we are reaching our most vulnerable populations, we will get those vaccines in arms. And that is the success that happened. That's what we demonstrated. We learned a lot, and we have great partnerships now. We have people that are very excited about this tool. The county is going to be posting a link to this tool where people can pre-register so that we can see where people are that are looking for the vaccine. And we are also, the Alliance for Better Health is going to be hosting, and this will be on the county website and on the city website, demonstrations every day this week at 9 in the morning and at 5 o'clock at night to show people how to register, and also to show how this list that will be cultivated, that will be created from this link will be used by vaccinators to be able to get vaccine into our most vulnerable community. So it was a lot of work. We learned a lot, and it wouldn't have happened without a partnership with the county and without the state believing that there had to be a better way than just setting up a link and forcing people to have to use their computer to make those appointments. And we were able to get 100% of that vaccine into people's arms, and we're very grateful that we were able to do that. So thank you.
Thank you, Mayor. And again, it does take a partnership. So I am happy to announce what the Mayor was just saying, that people can pre-register live for 1A and 1B category and sign up in advance. No more Hunger Games, people. We said it took a little bit longer than I wanted to when I announced this a couple weeks ago. But basically, the biggest complaint is people fight to get online, the pods fill up quick, and they're boxed out. So this way, with our website, you can go on. It'll be on our Albany County website. It'll be on the cities. You can pre-register, and when we get to that category, you'll be notified via text or via email, whatever you choose, that you're taken care of. If you want to still look for another spot to try to get a quicker shot, hats off to you. But if you want to be one of them people that have been home and been doing the right thing, and you know that eventually when we get to you, you're going to be taken care of, you will be pre-registered. So that means it might take 2 weeks, might take 3 weeks, might take a week. You'll have a slot. You'll be guaranteed the next pod, and we'll just go down the list in that category, 1A and 1B, which we're entitled to do, and then it depends on how it changes going into the future. But please, you can get the vaccine clinic at our Time Junior Center, or when Mohawk is planning to go out to do deliveries, which is good. And the website is going to be on our main website. It's albany.518c19.com. Please go there. It's up. It's live right now. So if you're watching this, you can go there. You can pre-register, and it's good to go. So again, it takes a partnership. So thank you for everyone doing that. And Dr. Whalen, thank you for what your team's been doing, not just with the vaccine, but the 11 months prior to all this when we were going through everything else. But Dr. Whalen.
Good morning. So I think this is a great update to hear about the various ways that vaccine can be got out to our community. And most importantly, it highlights the knowledge that there isn't really a one-size-fits-all approach to getting vaccine out when we're looking at issues related to supply and the timeline of getting vaccine out, and also knowing the concern of the public and the fact that we are still very much in a situation where demand greatly exceeds supply. So to be able to get this out in a manner that ensures that equity is part of the lens of getting vaccine out is essential in the community. So I applaud Mayor Sheehan and County Executive McCoy for continuing to look towards innovative strategies to do this and partnerships that can expand vaccine in our community. As we go forward, it is likely that there will be other partnerships. And with expanded availability of the vaccine, we really are looking at many partners that we can work with to get vaccine out, either to communities that they serve, communities that they work, communities that they live. It is going to be, we are a resource-rich area in Albany County, and that is something that has always been a strong suit of ours. We're very lucky with the healthcare systems that we have, with the community partnerships that we have, and with the strong community government that we have to be able to create partnerships like this on a short notice and have the willing partnerships and ability to work of so many people. So, I appreciate these efforts and appreciate their importance going forward. We continue to work with the strategy that we have used at the local health department, which is to get the most vaccine out in the shortest period of time through our efforts at the TU Center. We have been able to get as much vaccine out as we get every single time. And tomorrow's pod, we will be vaccinating 1,100 1B essential workers, and we will also be doing a vaccine clinic of 500 second doses. And after the last press conference, I noticed there were a lot of comments on second doses and people concerned about the second dose supply, and is there a concern about that? And I want to reassure people that, at this point, the way the second dose comes to us, it's a completely different shipment. It is stored differently. It is kept differently, and it is only for second doses. So second dose supply goes to, it's a different lot, and we keep it differently. It is not different in its ingredients. It's the same preparation used in both vaccines, but there seemed to be concern that people thought there could be mixing or that we weren't actually getting second dose supplies. We have been assured at this point that we will continue to get that second dose supply. There is no consideration currently being given, as we may have heard earlier in national press, to just giving a single dose. The way that the Pfizer and Moderna vaccines that we currently have available in Albany County have been studied is as a 2-dose regimen, and that is how we plan to give them. And that is how every entity that is currently providing vaccines is prepared to give them. And that is how the supply is coming. So those of you that have received your first dose and are a little bit anxious about what that second dose, that waiting period of 3 weeks with the Pfizer vaccine and 4 weeks with the Moderna vaccine, please be assured we are getting those second dose shipments. We are holding them differently, and they are being held with your name on it if you have the first dose of the vaccine. So as you're aware, next week we do have expansion of criteria for the vaccine that we're able to give in our pod sites. And we are able to give that to individuals with chronic illness. This will include those over 65 with chronic illnesses. So while we have not previously been able to target that priority group, if you have a chronic illness and you are over 65, you are able to be vaccinated in our pod starting next week. We don't know what supply we'll get. We are hopeful. What we're hearing on the federal and state front is that there will be a continued expansion of supply. And it is our commitment to you that as that supply increases, we will get that vaccine out. As I've said before, we find out usually on a Sunday how much vaccine we're getting for the week. We don't know in advance how much we're going to get, and we cannot pre-book in advance a slot at our clinic. So it is a short turnaround. Generally, we post on Tuesdays at 5 p.m., as we did yesterday, and the slots fill up within about a half an hour. So this is, how we're currently operating going forward. If we have a significant increase, we are weighing the decision to operate a second day of the week, and that is our hope that we'll be able to get to that stage. As we get vaccine out, we will increase our efforts and look to continue these important partnerships so that we can ensure people can get vaccinated in a way, shape, or form that is convenient and doable for them. That is essential. I heard today that the CVS is going to start getting vaccine nationally as of this Friday. It does not look like that is coming into the capital region yet, but that's a space to watch. As we know, the larger retail pharmacies may represent, a place that may be convenient to many people as well. So there's going to continue to be lots of movement forward on expansion of supply of vaccine, expansion of places you can get vaccine. I know a lot of medical providers are very interested in getting vaccine, and some of the larger medical practices have been able to prepare to have large-scale pods. Hopefully this is something that we can work with our providers towards having them have a supply so people can also get vaccine in the comfort of their physician's office. All of this is going to be evolving in the coming days and weeks. And as always, we really ask people for patience at this juncture. We are pleased with the news that we continue to see a decline in cases, but want to reassure people that this does not mean that we are completely out of the woods. And in fact, we are concerned about the presence of the highly contagious variant and are very carefully monitoring for what that may do to trends going forward. That is an unknown at this point, but it does remain a concern. So for those of you that have not yet been vaccinated, who are not yet eligible for vaccination, please remain cautious. Please continue to do the behaviors that we have highlighted. Mask wearing is not going anytime soon. Even if you have been fully vaccinated, you should continue to wear your mask at this point in time, and continue to protect yourself and your loved ones by also avoiding large gatherings and continuing to maintain social distance when you are out and about. Thank you.
Thank you, Dr. Whalen, as always. And can't get through this without working together, correct? So, Dr. Whalen and the Mayor, you know more than anyone else what we've been going through with this health crisis the last 11 months and the toll it has taken when we were shut down for 5 months, and you don't see the ripple effect on the other end, meaning domestic violence, sexual assaults, drug overdoses, suicide. You know, these are things no one wants to talk about, but these are things that have ramification from any health crisis or economy crisis going forward. So I just want to, I have Dr. Giordano here, but I want to talk about a couple of statistics. Last year, there were a total of 99 opiate overdoses in Albany County. There were 62 in 2019. The graph on the screen will actually show you which months in 2020 were the worst. That's an increase of 60% between 2019 and 2020, a 68% increase over the last 5 years annually. It would seem all the process that we made and going forward in curbing this we took the step back. But again, it's something that we have to stay on top of and continue to educate people of fentanyl and mixing it with cocaine and the effect that it's having on people. And you can see around, not just around the state of New York, around this country, the amount of overdoses and people being lost to this new trend of fentanyl being laced with cocaine. And thank goodness that, you know, we have the epi, or not epi, I said epi, didn't I? Thank goodness that we have the opportunity to use Narcan to reverse this, and it's been successful. So I just want to, you know, one thing before I turn over to Dr. G, something we've been seeing over the country, and CDC recorded over 81,000 drug over deaths in the U.S. between May 2019 and May 2020. That's the highest number ever reported in a 1 year period. So that's why I have Dr. G from Mental Health here to talk about it. Dr. G.
Hello, thank you very much, County Executive McCoy. It is true that most people don't want to talk about this, and I think it is critical that we take a moment, take a breath, and kind of do a year-end update and retrospective, and focus on what many are correctly referring to as an epidemic within the pandemic. I'm sorry, can you hear me now? The good news I'll start with. I think that as a community we are more resilient than we ever imagined we would be. And I think we've learned that you only know your strength when you're tested to your limits. And we certainly, as a community, on every front have been tested to our limits. But the not so good news is that we've been injured as a community. And it's not only in terms of the daily reminders of the physical and medical injuries that we've sustained as a result of this pandemic. It's our mental health, our emotional well-being, our spirit, I think, has been injured. And the healing will likely take a long time. And I think we're still not yet fully seeing the peaks of this injury. It's so great to hear the mayor and the county executive and Dr. Whalen talking about some glimmers of hope on the medical front. We still have many fears on the behavioral health front. And one indicator of that injury, as the county executive pointed out, is this really dramatic rise in the number of opiate deaths that we experienced locally. And he is correct to say that this reflects, and the CDC has highlighted this, what we're seeing in Albany County is reflecting the counties that surround us and across the state and across the nation. And I've been here before you a couple of times over the course of the year, and we've talked about the risk factors and why this is the case. I think I don't want to go through all of that, but to remind you that vulnerable people are susceptible to this incredible confluence of stressors in the mental health world and in the addiction world, and pre-existing conditions can worsen, and non-existing conditions can get created as a result of all this. So yeah, we had 99 overdoses in 2020. It's the highest ever for us annually. We were able to kind of break out those numbers a bit. These are males primarily between in their 30s, although the group as a whole ranges from about 20 to 59. We look at the overdoses in terms of those that occur in Albany County. Not all of those that occur in Albany County are Albany County residents. When we broke this out, it looks like about 86% of those 99 that occurred in Albany County were in fact residents of this county. And notably, and this also is a trend that the CDC is highlighting as existing across the country, over 85% of those tox reports that came back on opiate-related deaths had fentanyl in them. And we've been watching this since 2012, and that one of the big changes is that the fatalities are more and more likely related to illicitly produced synthetic opioids like fentanyl, and either in combination with drugs like cocaine, and there was just recently a spike regionally. Schenectady was the first one, I think, to see it hit them. We put out an alert on this a week or two ago because a contiguous county was suffering, and we thought it was likely going to affect us as well. But that was a cocaine-related, fentanyl-related set of fatalities. And sometimes the cocaine is mixed with fentanyl. Sometimes it's just co-use of opiates and cocaine. But as the county executive said, the CDC is also seeing trends that surpass any that they've seen in the past. But for me, the only way to keep doing this kind of work, and I know Dr. Whalen said the same thing, you have to find hope in all of this, and I want to just give you a little bit of what I think is reason to be hopeful. That's the indicator of the injury, the deaths, but the indicators of our strength as a community is really remarkable. The legions of caregivers in the behavioral health world who also, along with all the medical providers that we've recognized for so many months, these behavioral health providers go to work every day, put themselves in various degrees of risk because of their compassion, their dedication, their caring. They've continued to serve us as a community every day. And for me, and I know I speak on behalf of the county executive and Dr. Whalen, we want to thank all the doctors and the nurses and the social workers and the psychologists and the peer counselors who work in our agencies to help. So a little bit of, I won't belabor this too much, but I think perspective is important if we're going to have any hope at all. So there were 99 opiate-related overdoses in 2020. That's in the context of today, 2,748 people in Albany County who are receiving addiction treatment. That's a large number, it's a scary number, but it's a remarkable number. I think it's a hopeful number. Of those, almost 60% are suffering in one way or another from an opiate-related disorder. It's over 1,500, 1,566 actually. And what I think is important to say, 1,566 people did not die today. They're in treatment, they're in recovery, and they're working on this. And so, the tragic numbers associated with the fatalities are wake-up calls to us and to all the folks that I work with and that work for me and for the county executive. But there's a lot of good work being done in the community, and I think we need to remember that. And I've said this before when I've come, almost 90% of those receiving treatment in this county for opiate-related disorders are receiving state-of-the-art, evidence-based medications for opiate use disorder. or otherwise known as medication-assisted treatment. I think that is also very important. So the message I think to take from this is treatment is available in this community. Treatment works. Peer support is available in this community. Peer support works. And recovery is possible. We've talked about this before. This touches all of our lives, all of our families, all of our places of employment. We all know someone whose life has been touched by this. And there's great innovation going on. In the governor's budget, he's talking about integrating the addiction and mental health communities at the state level. Well, in Albany County, we integrated our mental health and addiction services 5 or 6 years ago, because we know that people come to us with multiple problems and you should treat them in a holistic way. And we're moving towards, in our community, expanding some of our mobile outreach work to actually bring not only overdose survivor response to the community, but to bring treatment and support and outreach, which we'll have more to tell you about later on this year. So help people get this information out there. I think we're putting up some numbers that for outreach. You can always call the Department of Mental Health and look on our webpage for all of these connections. But the Open Access Program, which we partner with our community, with community partners like Project Safe Point and the Addictions Care Center, that number should be up. New York State Office of Addiction Support and Services has a Hope line, and we have had a support line, a mental health, behavioral health support line that the county executive asked us to put up way back when. Seems like a long time ago. But we're manning that daily from 8 to 5. I will say that, these are mental health trained people. They're part of our emergency mental health disaster team. These are folks that can really help. We're getting a lot of, and it's understandable, but lately a lot of people calling and asking where can they get a vaccine. And we try to help them, but we don't have all that information. But we do have the ability to help people who are struggling emotionally. And as I said the last time I was here, if we had lost 300 people in a single event, that would be a mass casualty event. We're trained to help in that regard, and we would certainly welcome calls from grieving family members or folks who are trying to find their way through this difficult time. Our mobile crisis team is still available 24/7, and we work with our community partners to do Narcan training monthly, virtually. On our website, you can see that the links for that. So I think the only way to proceed here is to try to find hope in all of this, and I think there's reason to be hopeful.
Thank you, Dr. G, and I agree. There is a lot of reasons to have hope in your life, and again, we'll get through it. We are getting through it. We are doing it. Our opiate task force is revening again to discuss all this stuff, and thank you to that task force that's been doing a great job, keeping us informed. But again, difficult times, and don't be an enabler, as they say in AA. Be a friend, be there. And don't kick them when they're down. I always say get them healthy, then kick the hell out of them. Once they're healthy and they're on their 2 feet and they can move forward, trust that. I went through it with friends, family members, and it's not easy, but they need your support now more than ever. They don't need you criticizing them. Just remember, people deal with things differently. That's why we established the mental health hotline, so people could call there and talk to them and talk about the new world that we live in for right now and going into the future. So please take advantage of all that. We encourage people to continue to get tested, whether you have symptoms or not, or you think you've been exposed. Please, as always, the partnership with Whitney Young, 518-465-4771. We cover the cost if you don't have insurance. The great partnership with the University of Albany. That's free, 1-888-364-3065. Go to albanycounty.com to see whether or not who's testing, what age requirements, and all that other good stuff. Our mental health, as always, please, 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. Also, we set it up for texting and email, so if you feel you can't make that phone call and that person around you is abusing you, please text us, and we'll make sure that we do the right thing and help you get through this tough times. 188-364-3065. I was mistaken. Our website goes live at 11:15. It should be live actually right now for people. And again, you can pre-register, and it's going to stop the Hunger Games for a lot of people. It's going to help you get on there knowing that you'll get a text way you sign up, text message back from us, email, however you want to be contacted. Also, there's going to be a drop down for health conditions, whether or not you fall into certain categories. That's going to change. So I will say this: Department of Health did say that they are going to be putting the governor's office is going to be putting out protocols on a variety of things. It may change before the 15th. So, we'll change it as we have to change the game plan. But it's there, it's simple. Please pre-register. But we just want 1A and 1B to pre-register, and we will make sure that you get the slot as the pots come in, so you're not sitting there fighting for it. Again, everyone out there, please stay safe and healthy.